Well, welcome everyone to the Community Connections for this evening on November 10th. My name is Tim Morris, and I am the chair of the Lung Association in San Diego's Mission Committee. This presentation is part of a series that the committee has formed, which began in the spring of this year and had an awful lot to do with the COVID response. And the committee of the Lung Association decided they would like to continue that for another fall series. So this presentation is part of the fall series. We've already had a number of different presentations, and those are all available on YouTube. We spoke about COVID-19 treatment north and south of the border, including some comments from doctors who are working in the Tijuana General Hospital. We heard some updates about emergency responders in COVID-19. We took a little break from the COVID-19 and talked about lung cancer screening, which was a really fascinating talk. And if you have a chance, I would suggest listening to that as well. We've spoken about the health effects of wildfires. We had a talk about COVID-19 among children, adolescents, and college students. And then our last session was about the biology of COVID-19 infection by two of the premier biologists in San Diego, speaking about the interaction of the virus in the lung. Today, we have a presentation regarding the county's response to COVID-19 by Dr. Sayone Thihalolipavan, or Dr. T as his friends call him. But first, we're going to start off with a message from Tony Gwynn.
The American Lung Association has been saving lives by preventing lung disease and promoting lung health in our local communities for more than 100 years. And today, achieving health equity is at the core of everything we do. We believe everyone should have the same chance at healthy lungs and clean air, but we all know that too often those families with the most to lose get the least access to quality health care, the finest hospitals, and even clean air. This is one reason we've launched Community Connections, free, interactive conversation with San Diego healthcare professionals and medical experts on the health topics most affecting our communities. My fellow board member, Dr. Tim Morris of UCSD, likes to call them dinners with doctors. For more information about weekly topics and more, please visit lung.org/events. I hope to see you there.
Well, thank you, Tony. Let me start off by mentioning that the Community Connections, this series is made possible thanks to the generous support from the Burr Heart and Lung Clinic at Sharp Grossmont Hospital, as well as the San Diego Foundation. And with that, let me turn over the presentation to Dr. T, who will be talking about the county's response to COVID-19. Dr. T.
Thank you, Dr. Morris. And so I'm sharing my screen. Hi again, everyone. Since we've last talked, a lot has happened, of course, in the COVID world, but thankfully things seem to be improving. And it sounds like you've had a wonderful series of seminars and dinners with docs to really learn about COVID, but then also other just as important, content materials that I'm personally going to go look at, the wildfire one myself and some other ones. So just to have a big overview on COVID, where we are, some of the things, some of the updates from CDC, some of the things we have locally. But before even getting to that, just a reminder that flu season is also upon us, right? Last year, we were able to prevent that twin-demic that we were worried about. But this year, unlike last year, we are mixing again. We are hanging out again. So it's much more easy to spread flu. And that's why it's, just as important, or if not more important this year, to get your flu shot if you haven't already. And so far, we see the flu vaccination rates are actually less than what they were this time last year. So, we do want more people to get the flu shots. And it is okay if you're also in line for, or, going to go get a booster shot, you actually can get both at once. And that's up to you, of course, if you want to do that. But there's nothing wrong with that. The CDC says that's totally fine. Just need to get them in two different limbs, so two different shoulders, for example, right? And before getting into the data and all that stuff, I love stories and love anecdotes. And this is really symbolic of a lot of what's been going on in America and the world, right? Where some folks, just because of ideological differences, they may choose, or access issues or other reasons, they may not get the COVID vaccine. And this is a story about two twins, and you'll get a copy of the PDF, so you can click on these links if you want for the sources. But this is a story about two twins who essentially grew up together, moved in Virginia, moved to Florida, and then they worked together. So they had very similar environmental exposures, and they had an outbreak at work. And during this outbreak, one individual was vaccinated, one was not. So Bobby, who was vaccinated, only had minor symptoms, whereas Billy, his brother, ended up unfortunately in the hospital on a ventilator. And right before he got on a ventilator, he actually kind of came around, converted, whatever you want to call it, and changed his thought process and started believing in vaccines and promoting them to his friends and families until, unfortunately, he was put on a ventilator and then eventually passed away from this disease that may have been prevented if he got the vaccine. So it's a sad story, but just a strong reminder that, right, there's a lot of suffering that's preventable, really, with many different interventions that we have, of which the strongest is the vaccination, right, that we have. And unfortunately, we reached a significant milestone earlier this month, just in the world, in terms of reaching over 5 million deaths due to COVID-19. And in the US, I know, sometimes I talk to folks and people question, are we even counting correctly? And even if you take away, the fact of how we're counting, et cetera, and you're questioning that, you can just look at all of the deaths that we have per year as per the CDC. And I will say that 2020 is still preliminary death data, and it usually takes about 2 years to finalize that death data. But we know for a fact that you could see that there's pretty stable death numbers, 2017, 2018, 2019, when you look across our whole nation, right? And then it jumps, boom, 500,000, more deaths in 2020. And we know why, right? We know at least what was the major contributor to those excess deaths. And actually, if anything, many people believe that COVID may be undercounted, especially in cities like New York or, Washington State early on, that, or even more recently with Delta, that where the hospitals where capacity was overwhelmed, and then people passed away in their homes, et cetera, or in other places, and may not have been counted as COVID. And then we know that with these deaths, that of course there's disproportionate impact on different individuals. This is a chart from the CDC, from their death statistics division, essentially, and where they looked at life expectancy, and they saw that Black American individuals already had the lowest life expectancy when you look at the darker green bars, right? And that's in 2019. And then in 2020, the lighter green, they had a big drop to 71.8. So they had the lowest expectancy to begin with, and then they dropped, even lower, unfortunately. And you see a huge drop here also in the Hispanic population, but they did have the highest life expectancy to begin with. And then when we look in San Diego County and you look at our deaths, we're unfortunately well over 4,200 deaths in our region. And when you look and compare, not even 2 full years of data to 5 years, 2015 through 2019 years of data for other things, and this is the most recent data you can find on the CDC databases, right? That's even more, slightly more than 5 years worth of heart attacks in our county. You see here 2,300 drug overdoses, although I'll frankly admit that overdoses are on the rise in recent years, and then car accidents and influenza. So you see these proportionally, even 5 years of these other diseases or conditions, aren't as much as how many deaths we've suffered as a region with COVID-19. Right? And this is probably the saddest slide, and I promise I'll get to more optimistic slides after this. But this is probably the saddest slide of all, which is the kids. And there's a lot of data showing that, and this is CDC data, and they released a report about showing that 1 in 500 kids have faced either orphanhood or caregiver death due to COVID-19, meaning they've lost a parent, they've lost a grandparent, someone who's essential in their life. And, unfortunately, that also is disproportionately affected certain race ethnicities or incomes over others. Right. So this is where we are right now today. Off the New York Times pulled this, in terms of COVID rates, and these numbers are very different than they were just a few weeks ago and a few weeks before that. Right. The lighter yellow means there's less COVID activity. So believe it or not, Florida actually has the least COVID activity when you look state by state basis. And then COVID has been kind of moving northwestern, and particularly in the north. Alaska got hit pretty hard. California, we were just maybe 2 weeks ago, we were the lowest COVID rate of any state in the country. But since then, we've gotten back to high transmission status, and then Florida has gotten lower. You can probably, some of the reason why the South and Southeast has a lower rate is probably because they were hit so hard with Delta that it really infected a lot of their individuals. So there's less people to infect. And then many people, because of the Delta's impact, did change their mind and get vaccinated, right? They weren't vaccinated to begin with as high as some other states like us in California. So they got hit much, much harder. Right. And so we're doing really well, but there's always opportunity for improvement, right? Especially with more transmissible strains or variants like the Delta strain. And so we have over 4 out of 5 San Diegans who are currently eligible are fully vaccinated. This number is these get updated every Wednesday. I don't have this evening's number, but this is from last week. But this is going to be updated, and these numbers will drop a little bit because 5 to 11-year-olds, as you know, are now eligible. And so this, and I'll say, 9 out of 10 of those 12 and older have been also at least partially vaccinated. Right? And when we look at who's being affected in terms of COVID infections or hospitalizations, it's also interesting to separate that by those who are fully vaccinated, by those who are versus not fully vaccinated. And you see that there's the case rate actually does differ, right? You're living in two different kind of worlds or levels of exposure or risks depending on if you're vaccinated. And so if you're vaccinated, you have a 3 times less chance or rate of getting COVID-19 in San Diego County today, right? And this number, I'll say, has fluctuated over time. Now that numbers are starting to come down a little bit, the difference is going to be less. So that's why you're seeing it 3, but I've seen this higher, 4 or 5 before. And that's a big deal because you can't spread an infection you never get, right? And then, and if you get infected, you're contagious up to 2 days before you even get symptoms, if you get symptoms at all. So, it's really important then for many people to be vaccinated. That way we're minimizing the amount of, even people who COVID could possibly infect to begin with. And then you'll see, vaccines really their strongest asset or their strong suit is really preventing us from dying from COVID, from going to the hospital with COVID. And you can see this difference is 14 times, higher chance of getting hospitalized if you are not fully vaccinated. That is huge, right? So you have over 14 times, and this number has gone up, believe it or not, to over 100 times at its peak in terms of that difference of versus hospitalized versus non-hospitalized versus, when you're comparing vaccinated to non-vaccinated individuals. So, and as the numbers continue to go down and the hospitalizations due to COVID go down, the difference is going to be smaller. So that's what we're seeing here. And it's not 0 for fully vaccinated, but it's absolutely less. So if you can prevent yourself from getting to the hospital, and all the things that come along with that, why not? Get vaccinated. And here's the actual numbers as well as the percent. So when you look from the new year and then in the last 30 days, you could see that still, 91% of the hospitalizations are those not fully vaccinated. Since the new year, 97% of those not fully vaccinated have been, those who end up in the hospital. And so these are really interesting numbers. Of course, they get much smaller when you're looking at deaths in the last few days. And when we look at the ages of those who are getting COVID or hospitalized or dying from COVID, it's also really fascinating. And so I want to bring your attention to the middle part of this, because I know there's a lot going on in this chart, but this compares, cases by vaccination status in the last 30 days. And so just looking at the last 30 days, you see that the average, or the median, age of those who are getting COVID-19 is 43 years old if you're vaccinated, but if you're not vaccinated, it's 29 years old, right? And then if for hospitalization, it's 70 and for deaths, it's also 70 if you are vaccinated. But if you're not vaccinated, right, that number for hospitalizations goes much lower to 57 years. And we are seeing that, those hospitalizations during the Delta surge has been, on average lower or younger than, the hospitalizations that we had in the winter surge. That's because we have a pretty good vaccination rate amongst our, older adult population here in San Diego. But you're seeing that deaths, right? You see here, the median is about the same. It's 70 and 72. And this is why the booster conversation is an important one, because, when it comes to the data and who's most vulnerable still to getting hospitalized, even after vaccination, it is the older adults. And I know you see numbers as low as 48, but it's still, the data overall that the FDA and CDC used to make their decisions a couple of weeks ago about boosters really showed that those older adults are most vulnerable, which is why the recommendation of over 65 getting boosters or 50 and over with underlying conditions, is an important one. So this is our case rates. Again, this is one way to look at it. Another way to look at it is by vaccination status, as I've shown you. And this is our same, also looking at case rates, but this is another way to looking at it. CDC, this is a weekly case rate, different way that CDC looks at it. And you'll see that we are back in the high transmission zone again, or segment or area. And then you can look, of course, vaccinations by race, ethnicity. You can look at many different ways, right? And when you look at race, ethnicity, just like I mentioned a couple months ago when I was last on this program, is that, right, there are some disparities here. And so we are seeing lower vaccination rates in the American Indian, Alaska Native, and the African American populations. I will say some caveats is that compared to the total numbers that we have who are vaccinated, and this is in the fine print below, this type of data does not include, for example, all of our military data, because they just give that to us in aggregate, but don't break it out by certain things like race or zip codes and stuff like that. So some of this may be, and likely is, higher than what you're seeing here, but there's still definitely a lower trend amongst these groups. And then same with ages, you see that there is also a disparity here, and the least likely to get vaccinated actually is the most likely to get infected, and that's the 18 to 29-year-old age group. They have the lowest vaccination rate. The 12 to 17 was the most, prior to the 5 to 11 just being recently available, they were the, most recently eligible before that, and they caught up and surpassed the 18 to 29-year-olds, right? And these folks are the most likely to get infected. And the reason that's important is even if they're not getting hospitalized at the same rate, things like that, they can still be moving around, transmitting it, spreading it to other people, because like I said earlier, you can spread it up to 2 days before you even get symptoms, if you get symptoms at all. This was really interesting because when we call the cases and ask them, hey, where do you think you may have gotten exposed? We see that in the last 3 months, right, some of these info has changed where they're saying that they're less likely now, slightly less likely to get exposed at home, but more likely to get exposed in community settings, with travel, with daycare, things like that. And so that's important because, as societies reopen now to a larger degree, right, there's other places that people are getting exposed and spending a lot of time with other people outside of their house, right? And that's okay. I'm not saying that's a bad thing. I'm just acknowledging that, this is what we expected essentially as we reopen society. And then this is just a figure showing kind of, which variants. I know there's a lot of variants out there and people may have questions about that, which I can answer later, but Delta continues to be, has overtaken the UK variant or the B.1.1.7 variant, which was already more competitive. And now Delta has overtaken that. And so, this continues to stay the most competitive variant and continues to be overwhelmingly what we're seeing in San Diego. And so, like I've said before, right, whether or not we were infected by COVID-19, all of our lives and our livelihoods were all affected by COVID-19, right? And here's some examples. Here's another example, right? Within our youth, we've seen that our BMI has their BMI has gone up higher than expected. We know long COVID, right? That even if you're not, you don't go to the hospital, you can still suffer. You can still suffer at home. I have a lot of friends and colleagues who've had COVID at this point, and I think most of us know people who've had COVID if we haven't had it ourselves. And even suffering at home, just like the flu, right, sucks. And it's not convenient to anyone. Of course, it's concerning. And some people, even if you don't get hospitalized, you still can have mild COVID to begin with, or moderate COVID, not get hospitalized, but then continue to have certain COVID symptoms, or what's called long COVID, or long haulers, or chronic COVID. And so, this is a definition that we use, or the CDC uses, for people who continue to experience these symptoms after a month after getting COVID infection. And I know, Janet, you asked a good question. I don't have a slide with those specific symptoms, but a lot of those symptoms are, some people can continue to have loss of taste or smell. Some people can continue to have fevers. Some people can continue to have heart rhythm disturbances, palpitations or speeding up of the heart or things like that. So there's a lot of different things that people can have, and it can affect people's mood. It can affect their livelihoods. And so it is important. And the best way to prevent long COVID is to prevent COVID to begin with, right? And one of the best ways to do that, of course, again, is vaccination. And then there's these rare conditions like multi-inflammatory syndrome in kids. I know a lot of people have expressed concern about what's called myocarditis, or inflammation around the heart tissue, about vaccines. But believe it or not, kids actually get more myocarditis from MISC, which is this syndrome. And here's a local example from September, I think, right, in San Diego. So this is something that often presents with myocarditis as well. And it's often worse forms of myocarditis than the ones that people can even possibly get, even if it's rare, with vaccines. And I'll talk to that a little further later. And then we've seen, the impact on kids. When you're talking about 5 to 11-year-olds, right? This is data presented recently at the FDA meeting. When you look at causes of death, and this is 2019, the latest available of complete full causes of death, right? You look at just 1 year of COVID data. Of course, we know there's been more deaths outside of that 1 year time period in 5 to 11-year-olds, right? It tied with the 8th leading cause of death in the 5 to 11-year-old age group. And this is important because how many kids should be dying who are 5 to 11? And the answer is 0, right? So all of these deaths are so important in terms of, doing whatever we can to prevent these deaths, because really we shouldn't have any deaths due to COVID in these individuals. We shouldn't have any deaths in 5 to 11-year-olds, right? They don't have chronic diseases at this point in general, right? So then often it's other things either that we can't control or we don't have a good handle on, like how to prevent accidents or cancers or things like that. But we absolutely should, even though this is a small number compared to adults, this is very, very significant in terms of, deaths. And again, this is the worst outcome. But believe it or not, when we look, or when Rades looks and we as a country look at kids' hospitalizations information, there's really not an association, or it's not as strong for having underlying conditions or not. And I know that some people say, oh, well, yeah, obesity or like some underlying conditions are what are landing kids in the hospital. It's not, that association is not as strong as it is in adults. And that's important to know if you're a parent like me. And you want to protect your kid from getting hospitalized with COVID, or they can get multi-inflammatory syndrome even if they don't get hospitalized, right? Weeks later. And again, why really we're here and still talking about COVID has a lot to do with the variants that are in circulation. And right now that is Delta, which is much more contagious than the initial COVID strain and even more contagious than the UK or the Alpha strain, right? But even with Delta, the vaccine still, you're right there. This is in a publication from CDC. This is a couple of months ago, but even with Delta, right, fully vaccinated people had a reduced risk of infection, hospitalization, and death by 5 and 10-fold respectively. And then I showed you that local data. And then when we look at adolescents, there was this study that looked at all of these pediatric hospitals across the US and showed a 93% reduction in hospitalizations amongst adolescents who were vaccinated, right? When you looked at who was in the hospital from COVID-19 who were adolescents, 97% were unvaccinated. That's another way of saying it, right? And none of the vaccinated adolescents who were hospitalized, that 3%, none of them made it to the ICU, whereas some other of the unvaccinated did. So that's where vaccines really are strong in terms of preventing severe COVID. And then when you look at pregnant individuals, when CDC looked at the hospitalizations of pregnant women or pregnant people who are hospitalized with COVID, is actually, interestingly, this exact same number, 97% of those who were hospitalized were not vaccinated. And so CDC went from saying, pregnant individuals could get vaccinated when they first introduced vaccines to now, or more recently, saying pregnant women should get vaccinated. And both of the organizations that represent, obstetrician, gynecologists, both are also echoing that exact same message, very strongly suggesting that pregnant individuals should get vaccinated. And there's other benefits too, right? You can pass along the antibodies if you're pregnant, if you're breastfeeding as well, right? And then this is one example of a study where they showed that in cord blood, they found maternal antibodies. So you can assume that, right, if you find in cord blood, that those antibodies are being passed along to the fetus. And then this is an interesting study over the summer that showed, over nearly 870,000 women who gave birth during the first year of the pandemic. They found those with COVID-19 were more likely to get admitted to the ICU by 5.8 times, over 14 times, more likely to require intubation, and 15 times greater chance of death from COVID-19, right? Due to COVID-19. So anything we could do to prevent anyone who is pregnant or likely to become pregnant from getting COVID-19, we should do, right, for the protection of the mother as well as the fetus. And so that's why vaccination is being pushed so significantly. Another big update since we last chatted is that mood disorders has been added as an underlying condition, in the laundry list of underlying conditions that could put you at risk for more severe COVID-19. So that is mentioned here, is linked here to the page, the CDC page as well. And I do want to just take a little bit to acknowledge breakthrough infections, right? We know, and I acknowledged earlier, vaccines are not perfect. But remember, so many of the interventions that we do on a day-to-day basis, the decisions that we make, are based on things where we still favor and still do things, even though they're not 100% perfect. We choose to wear seatbelts, or wear bike helmets, even though if we get in a crash, we may not be 100% protected. We know that will significantly reduce our chance of death or brain damage if you're wearing a bike helmet, for example, if you get in a crash, right? If you don't want to, if you're not ready to get pregnant, we know that birth control, right, or condoms are a great intervention to help you prevent that unintended outcome, right? And things like that. So we make choices on a day-to-day basis, even if things are not perfect. And so breakthrough infections, though, are a very real thing, right? And I've also personally known, and many of you may know, people who were vaccinated who did get COVID-19. Thankfully, the people I know who got COVID-19 personally, did not end up in the hospital. And this is just showing two recent studies that, just showing again that all three vaccines still provide that strong protection against death from COVID-19, even if they became less effective against mild and asymptomatic infections, really. And that's partly due to the fact that, time has occurred and there may be waning immunity, but just as likely or even more probably likely it's due to the fact that Delta can avoid or avert some of the vaccines antibodies. So I know some of the companies, or at least one of them, is working on upgrading their formulation and doing some studies around that just to be better suited for the Delta variant and other circulating strains. And I wanted to, highlight, this was a tragic story you saw when about Colin Powell, Secretary of State, really passing away a few weeks ago. And when I heard the news reports, even from what I consider more reliable news sources, right, they were saying, oh, and he was vaccinated, but they didn't really give the whole story. And I just wanted to give this a little bit of attention just to remind us that, the people who are most at risk, of severe COVID or really severe most conditions are those with underlying conditions, right? So he was being treated for Parkinson's. He had cancer, multiple myeloma, blood cancer, and so he was getting treated for that. So he was what we would call immune compromised. I understood and found out later that he was scheduled to get his third dose of his vaccine, not booster, but his third dose because he was immune compromised, but he hadn't gotten it yet. So, and as a reminder, if you're immune compromised, right, the recommendation is to get a third dose because the vaccine might not have been as effective in you because your immune system does the second half of the job. After you get the shot, your immune system is the one that makes the antibodies based on what you got exposed to. So if you don't have a functional immune system or 100% functional one, then you may need a third dose just to even get you closer to where the majority of Americans would be with 2 doses. This is a great, just a clipping from the UT, or Union Tribune, recently, a few weeks ago, really showing that since June 1st, you can see on the left, fully vaccinated in terms by age group and by hospitalizations and deaths being the darker bar, right? You could see that there's very much less on the left column, and you could see you could squeeze it into that thin column versus the column on the right for not fully vaccinated. This is just visually showing you the differences, right? Not just by age group, like there are people who are hospitalized from 0 to 11 where there's 0 people who are fully vaccinated. Obviously, there's no one fully vaccinated, at that point who was eligible. But so you really can't compare that first row. But then after that, you can compare 12 to 19 versus those who are fully vaccinated because they've been eligible for a while now, right? And 0 of them who were vaccinated have been hospitalized. And then, and you see here, and this is even more striking because most of our county who are eligible are vaccinated, right? I said 82% earlier. So even that smaller 20% or so who are not vaccinated are making up a larger proportion of the hospitalizations and deaths. And this is data from Texas. And if Texas State Department, they're totally acknowledging this very recent, when they looked at recent data, the whole year's data, and then even the last month, right? They saw themselves, the unvaccinated people were 45 times since the new year, or since January 15th, sorry, more likely to get infected, or 40 times more likely to to die from COVID. And then in more recent times, you see that numbers reduced to 13 times or 20 times respectively. And then this is very interesting and important because a lot of people I speak to choose not to get the vaccine because they got COVID-19 infection. And, the two aren't mutually exclusive. And because you had one, I talked a lot about how you could get breakthrough infections, but because you have had COVID-19 infection does not mean you don't get it again. So it's still important to get vaccinated, even though you do have immunity for a little bit. That immunity may differ depending on who you are and your body, right? Versus the vaccine, which is pretty standard of a response in most people, except those who are immunocompromised. At least for the initial response for the first few months. And so this study by CDC, and then they released a kind of a science brief as well, really details that those who, when they looked at people who were hospitalized with symptoms similar to COVID-19, they saw that those who are not vaccinated with the previous infection, so you got infected, you chose not to get vaccinated afterwards, were 5 times more likely to get reinfected. And hospitalized than someone who's vaccinated, right? Who was infected and then chose to get vaccinated. So this is really important, right? So if you get vaccinated, you're preventing yourself and you're decreasing the chance of getting reinfected and hospitalized. And so, and you could see here, the data shows that the vaccination can provide a higher and more consistent level of immunity to protect people from COVID-19 than infection alone. So please, please, please let people know who've gotten infected that they still should get COVID-19 vaccination. It's okay to wait a little bit, but they should not wait forever on that. Okay, and then the more recent significant news especially for parents or grandparents, is that kids 5 to 11 are eligible now for vaccines, and so for Pfizer specifically. And so this is the same in terms of timing, 2 doses, 3 weeks apart or 21 days apart, but the actual strength or the dose is smaller. It's 1/3 of that is used in the 12-year-olds or in adults like us, right? And so they did the studies, they had really good results, and then they even expanded the numbers in the trials just as per the FDA, just to look for rare outcomes. And thankfully the outcomes were great. So this is a great slide from the FDA and CDC talks that was used when they took the numbers and they did modeling off of it, and they estimated that for every million vaccinations of 5 to 11-year-olds, whether you break it out by females or males, this is how many cases you prevent, hospitalizations, MISC cases, and ICU admissions. And you can see this is significant, but what's also not accounted for is the amount of COVID that they're stopping from spreading, right? Because again, you can't spread an infection you never had. And so if you prevent this many cases, you're also preventing the further spread of it, right? And so you're interrupting that cycle of transmission. And then there's a lot going on here. It's very small to read here, but just about myocarditis, which I talked about earlier. There have been 9 cases of concern reported in the what's called VAERS reporting system, linked to myocarditis related to the vaccine, but there's been no deaths, and and really these kids have done very well. They've gotten hospitalized maybe for observation purposes, but generally speaking, they've done well. And then versus almost 10% of kids with MISC have myocarditis, which is much more severe than the myocarditis from vaccine, right? And there's more info there. So we talked about the 5 to 11-year-olds. That's open, available now. You can go to coronavirus-isd.com right now. You can talk to your local provider. You can talk to your local pharmacist to see if they can take your child or your children if they are now eligible. And then also in terms of for yourselves, right? Many of you are wondering, okay, well, what about the booster dose? Am I eligible? Is it my time? Should I get a booster dose? Do I need a booster dose? So here's the recommendations right now. So for Pfizer or Moderna, so these are what's called messenger RNA vaccines, then you are eligible if if it's been 6 months since your last dose of the series, and then there's these different conditions, right? If you're 65 and older, if you're 18 and older and you live in a long-term care setting like a nursing home, if you have underlying medical conditions, if you're at increased risk due to social inequities, or if you live or work in a high-risk setting. And I'm going to break this down even further in another slide. And then for J&J, if you got a J&J shot, the CDC and FDA, when they met and they went over that data, based on the additional data from J&J that was provided from them, they're saying that, everyone who got a J&J shot should get a booster, should, not could or may, but should get a booster at least 2 months after. So most people were vaccinated, earlier on, and it's been 2 months already. So most people who've gotten J&J are actually eligible now for this booster. And the reason for that is that J&J from the beginning wasn't as effective. And we knew that. The data were very clear on that, but it was much more convenient, and it still had a strong protection against hospitalization, which it continues to do. But now, the booster argument for them is that this will really help everyone get, it'll help them boost their immunity because they never had as much to begin with, and some of that has maybe been declining over time or due to their age or underlying conditions. Due to their immune system. And so this is another way when I talk about, in the last slide, I'll just go back a second, when I talk about high-risk settings, people who live or work in high-risk settings, this is how CDC defines high-risk settings, right? So if you are a first responder, if you're education, food, agriculture, manufacture, corrections, postal worker, public transit, grocery stores, things like that. So this is great. And this link at the bottom is wonderful to really go over a lot of Q&A around boosters. The CDC also and FDA also said that they're okay with what's called mixing and matching, even though this is not necessarily preferred. It is an option, especially I know most of the concern has been people who've gotten J&J before, wondering if they can switch over. But so, if you want to, you could. There's nothing wrong with this, but of course, talk to your provider if you're concerned about this or if you have questions. And then in terms of just some of the questions that we hear often, I'd probably say these three are some of the top ones around boosters. And, are you still fully vaccinated if you don't get a booster? And the answer is yes. So far, CDC has not changed their definition of fully vaccinated. That may change in the future, but as of right now, I'm not aware of anything. If you need a booster shot, does that mean the vaccines are not working? No, I showed you the data, right? Showing that especially with severe COVID, with hospitalizations, they are absolutely working. They're not 100% perfect, but that doesn't mean they're not working. It's just that they're starting to see signs, particularly in older adults, where some of that protection from the vaccines are decreasing. And because COVID is so rampant and we have these new strains, that's why the booster discussion is really important right now and has come to light. In hopefully a couple months or maybe years, and no one could predict how this is going to go. But when COVID gets more managed, when the more the world gets vaccinated, maybe my prediction is we won't need boosters as often, right? But it totally depends on what variants we're dealing with, et cetera, and how the prevalence of COVID or the incidence. And then what about people who've had breakthrough or post-vaccination infections? So there isn't guidance yet for that population yet, but please talk to your provider if you have questions, if you did have post-vaccination infections. And then I already talked about third doses for those who are immunocompromised. Here's the info. If it's particularly for anyone who had Moderna or Pfizer, they should get her third dose. And then more recently, for anyone who had J&J to begin with, just even one, they should get a second dose at least 2 months after. And I know there's a lot going on here, which is why the main point I'm going to make about this slide is go to our website. We break this down in a table format and a much bigger font. And you can see, okay, I had this vaccine and this is what, applies to me in terms of who I am, what age I am, where do I work, etc. And should I get a vaccine booster or may I receive a vaccine booster? And you can see here what that recommendation is. So it's essentially just translating or showing the CDC recommendations in a different format we think is easier to read. And reminders, we're going, approaching the holidays, right? There's between Thanksgiving. I know we have one tomorrow, and I do want to acknowledge any of you, if you are veterans, really thank you for your service. We wouldn't be here, many of us, right, if it wasn't for your service. But I did want to say, as we're approaching these holidays, many of us celebrate by gathering and by being around those who we love. And so we just want to take extra efforts to protect ourselves and those who we're going to go hang out with and visit, right? You don't want to be the person introducing COVID to your family gathering. So do whatever you can to prevent that, and testing, wearing face coverings, getting vaccinated, etc. These are all reasonable things that you could do, without too much effort, that can make a huge impact in preventing spread of COVID. And here recently, you may have heard it just this week, the US implemented new rules about international travel. We as a border county, we did open up our borders. And so this applies to us more than many other jurisdictions. But now we are allowing fully vaccinated individuals to travel to the US by plane. And then we also, it's not here, but we also opened up our borders a little bit more too. And so there's more info here, and here's some info, if you come back, you still need that test regardless of vaccination status. Okay. And then also wanted to just say, in full transparency, I know a lot of the concern around vaccination were around, what's called Guillain-Barré syndrome, thrombosis with thrombocytopenia syndrome, and myocarditis. Even if you take those and the groups most affected by those respectively, and the FDA and the CDC, when they presented these modeling slides at some of their meetings, and they showed that you still prevent this many hospitalizations, ICU admissions, and deaths in these respective age and gender groups, for a trade-off of this many of these cases. And again, want to remind you that myocarditis has not been something that's led to any deaths. GBS, also the same, I believe. And then TTS, it did very early on, but that was only in the very initial. But since then, we as a medical community, there's been so much awareness raised, and now we are aware of how to handle these rare outcomes. And again, these are extremely rare outcomes. And if you do get COVID, just a reminder that there is what's called monoclonal antibody therapy. So you may have talked about this at one of your last sessions when you talked about treatments. You probably talked about this, and there's continues to be multiple sites around the county. And the most important thing is probably just to know that you can call this number to see if you're eligible. Most adults are. And most people 12 and older are, or many people, I should say, 12 and older are. And then if you have underlying conditions, if you're in a even a race ethnicity category that's more likely to get severe COVID or be impacted by COVID, you're probably eligible. So you can call this number, and they can also direct you to your closest monoclonal antibody center. And then what's on the horizon, but not yet available to us, is these pills you're probably hearing about. Merck has one. Pfizer just announced last Friday that they have one. I don't have a slide on them, but Pfizer's one had a little bit much better data surrounding it. But all I've seen is a press release so far. But these are going through the FDA to see if they'll get FDA emergency use authorization. So instead of a monoclonal antibody, you might get a pill, which is arguably much more convenient and easy to kind of distribute across the country, right? So that's a big thing we're seeing. But again, a strong reminder that these are more adjuncts or supplements, to support COVID treatment, but not replacements for vaccination, right? Because by the time, if you don't get vaccinated and you're waiting for yourself to get COVID and then get treated, you never know, right? These aren't 100%, and it may be too late, especially since many people don't even wait a few days to get tested to begin with after symptoms. And then two, you already spread it to other people, right? In those days before you had symptoms, or those days leading up to when you found out you had COVID and maybe finally isolated yourself, right? So that's important still to get vaccinated. And then as a second last slide, I'll say, one message that personally I think sometimes doesn't get emphasized enough is that this is the time more than ever to triple down on living well, right? making those healthy choices. We need to manage our chronic diseases so that we're not at higher risk for severe COVID. All right. We want to make sure our kids don't gain that excess weight. We don't want to put them at higher risk for hospitalization or a severe COVID or severe flu, or other things if they get those in general. And so please take time for yourselves and your family. Make sure you're evaluating information correctly. So this is now we because of a lot of the misinformation out there, we've developed a whole section of our webpage just on evaluating information. So strongly encourage you to look at this, to look or watch our health misinformation panels. We have now 2. After every board meeting, we have the next day, we have a series of physicians around the county, and it's facilitated by my boss, Dr. McDonald, who goes through a lot of the misinformation that's come up at the board meeting, just to get the facts from a trusted non-county government provider. And, I'm sorry.
Good morning, everyone.
I don't mean to play that. And then there's, of course, plenty of other resources like this website where you could listen to doctors and nurses and community health workers in multiple languages. There's our own Rady Hospital and AAP have produced videos for parents. There's videos like this about fertility or busting the fertility myth. There's videos like this talking about long-term side effects, I know, which has come up a lot. Okay, and then I'm just going to skip right to here, which is just a reminder that we have to continue to layer these imperfect interventions on each other to really prevent the spread of COVID. So I know I've talked a lot. Let's stop here. And Dr. Morris, let me check to see if there's any questions in the chat. Nothing, but.
Dr. T, thank you very much. That was a great talk. It was really informative, and I learned a great deal. I would say just a comment, I'm way at the other end of the food chain. I'm in the intensive care unit, actually. And nowadays in the intensive care unit, we are seeing the overwhelming majority of COVID patients that end up in the ICU and being sick and dying are the unvaccinated people. There's no question. Every once in a while, one will show up that has been vaccinated, but as you said, most of the county population has been vaccinated. And so, that's where most of the people are, but overwhelming majority of folks that end up in our hands now are unvaccinated. And I have a question about the people who are not vaccinated. First of all, just out of curiosity, it's interesting to see the statistics for fully vaccinated are always about 10% less than the partially vaccinated or received the first dose. And is that just because it takes a while to get the second dose, or do people actually, are they taking the first dose and they change their mind, or they're lost to follow-up or something?
It's both. It's both. So there are some people for sure, and specifically with the Delta surge and some of these, requirements that have been coming into play or mandates, whatever you want to call it, there have been more people starting the series in the last few months, but definitely there's a group and it's a smaller group, but there is a group of folks who have not gotten their second dose. So when we talk to providers, we're often saying, make sure you're double checking, you're doing reminder recalls, you're really making sure your people who have not completed their series to even complete their series, because there are some.
Great. And I guess the related question is, what is at this point, what's the objective or the strategy for the remaining, 10, 20%, 10% who have not gotten any treatment, and then maybe 20% who have having fully been vaccinated? Has the strategy changed since the last time we talked?
Yeah, for sure. I mean, it's changed in the fact that, we continue to survey individuals around the county. I know there's obviously state and federal strategies too, but a large part of the strategy is now, we're dealing with individuals who just for ideological reasons don't want to get vaccines. Many of those, as you see, there's race, ethnicities, there's political divisions, et cetera, but many of those individuals still trust their providers. So our main goal is to try to get people just to be open to a conversation with their own provider. We know that that's a fact, science-backed individual in their community who they trusted their rest of their health decisions to. And so we hope that individuals continue to trust their provider. The other thing is that we do have our own community health workers that we contract with multiple organizations who are in the community and who are talking with these individuals, and we are giving them updates, on and answering questions if they have them, to be able to spread facts, and address this misinformation. We know that there's a lot of misinformation, particularly on social media as well, and that's not necessarily a political thing. One other thing I would say is that, we also, I think as a country, we seem to be benefiting from these vaccine requirements or mandates, that individuals who said they aren't getting vaccinated, at the near closer to the last minute, they are changing their mind. They can always choose to go work somewhere else, or they can, but many of them are choosing to continue to stay at their current place of employment and get vaccinated.
Great. And there's a question in the chat about a room about Native Americans in the tribal communities around San Diego. How is it going with those people?
Yeah, as you saw, the data are lacking with Native Americans, but a couple of things. One is that we have a tribal community kind of a sector call, and where we engage with our representatives from the tribal community. They are not in, even though they're located in our county, we don't have direct jurisdiction over them. So some things may or may not apply in terms of our public health authority into tribal lands, etc. But I know the federal government, CDC, they have divisions that work directly with tribal government. They give them vaccine directly in some cases. So it's we have partners like CAL FIRE who are out in back country where a lot of these tribal countries are, nations are, and are able to at least provide access points in addition to ones that already exist there. So I know we're trying to do as much as we can, but the question is, why is it not more effective? So, and that's
great.
I don't know the full answer, but a lot of effort.
I was encouraged, I think encouraged the other day when I was driving by the bay and I saw a couple of cruise ships in harbor. And it occurred to me that now, the San Diego, who depends in large part on tourism for at least some of our economy, looks like that's coming back, and the airports are filling up, and the cruise ships are coming in. Is there a county response to that? Are you anticipating problems due to increased tourism?
I'm sorry, what was the last part?
Are you anticipating some problems due to the increased tourism? Is there some response that the county is planning for that?
Yeah, I mean, we're of course tracking, even if someone gets infected in San Diego County, or if we find them through a positive test, we will call them or we'll work with the jurisdiction they're from to make sure we understand some of the specifics, even though they're not being counted in our data. There's a lot of work that we do on non-county residents who have COVID-19, and some people, honestly, at this point, some people from other parts of the country may be coming here and getting vaccinated because they're staying with their family or something for extended periods of time. So, and that's okay, right? These are free of charge from the federal government, and anyone who resides here can get it. So in terms of strategy though, definitely, I know a lot of the cruise ships are taking measures, to prevent that. They are recommending vaccines. For international travel, of course, it's recommended, and it's required now for people coming in who are not U.S. citizens. So, I think those are bigger picture efforts, especially by the CDC or the federal government, in terms of requiring vaccination to enter, being something that's very, very helpful to decreasing the chance of spreading COVID. And then also negative tests.
Great. Well, I think our time is just about up, so I just have enough time to thank you, Dr. T, for another brilliant talk. We've certainly benefited from your enthusiasm and your passion and your intelligence. And thank you for doing such a great job for the county, and thank you for coming to talk with us.
Thank you. Team effort for sure. Thank you all for allowing me to talk and spread the word.
And we look forward to seeing you again next week, when we'll be talking a bit about wellness, both from the standpoint of mindfulness and
Yeah.
from the standpoint of nutrition. So until that time, thank you very much. Everybody have a good night.